Hey everyone, it's the Dr. Jason West Show, and we're going to be talking about natural treatments for vertigo. Basically, that is the inability to orient yourself on the horizon. And welcome, welcome. I'm so excited to give this presentation because it's one of the things that really affects people. They just cannot function when they're having vertigo. And so I'm excited to give some natural treatment considerations for what can you do for people that are dizzy or vertigo. And sometimes those are used interchangeably. I consider, dizziness is like when you're on a merry-go-round or one of those, those things that they have at the playground when you're a kid, and it spins and spins and spins, and then you try and get off of it. Guess what? You're spinning too. Vertigo is basically the inability to just orient, and it's a huge problem for people. And I'm excited to give you guys some insight and some ideas of what you can do at home, some natural things that I've seen some good outcomes, some advanced treatments, kind of a quick overview of the medical treatments. And so if you're just joining us, what we're talking about is the natural treatments for vertigo. Here it is. By the way, if you're picking this up later and you want the ebook, so I have a really nice ebook. It's about 10 or 11 pages on vertigo, some things that you want to be aware of, and some natural treatment considerations. And you can pick that up at drjasonwest.live. I'm going to show you guys that in just a second. The profile looks just like this. Let me show you. Okay. Wait, well, nope, that's the wrong thing. All right, here it is right there. Dr. Jason West. If you guys go over there, you'll see that you just get for free natural treatments for vertigo. And there's some past classes over there that are kind of fun. So things like fatigue and everything heart related and fatty liver. And I'm going to pick that up a little bit later. So I'm not going to be worried too much about it. But here we go. Let's just jump right into natural treatments for vertigo. Here we go. The presentation is teed up. Let's do this. Okay, so I can't do very much without giving a big shout out to my team. This is at the West Clinic. We just had a patient come from Kansas City. We took this picture of her and the team. And again, past programs over at drjasonwest.live. I already talked about that just a little bit. Now, if you want to do some work with us, and we do treatments for people across the street and across the country, all you have to do is go over to our website. It's the West Clinic Online. And all you have to do on there is you just click on that little new patient link. We can design treatment programs. If you are in New Orleans, we can do live treatments with you. If you're from New York, or you're just right up the road from us, we do this all the time. We work with doctors, and all we care about is getting you better. I don't care who gets the credit. So let's just start jumping into this. That's how you can get associated with us, is to go in. I also forgot to mention a special sponsor for our program is the Henry's Guild. It's a doctor's training program that we're doing to change doctors into doing these 100-year-old protocols that my great-grandfather taught my grandfather taught me. And the motivation behind this is one of the biggest frustrating comments I hear in the office is when patients say, I wish I would have found you or someone like you earlier. Well, let's try and spread the knowledge. There's no shortage of sick people. Let's just go and find them. And also, our organs, tissues, and cells sponsor. This is where we're going to get the natural treatments that we're talking about for vertigo. It's coming right up in here in our back office. Dr. Nelson Shelby, we treat a lot of people, or finding a lot of treatment plans, coordinating together. And so let's just jump right into vertigo and the basics. So here it is. I think that dizziness and vertigo sometimes are interchangeably used, but man, that feeling of faint, woozy, weak, unsteady, where it can really affect your life. Sometimes people can't drive, they can't walk, they can't get up, they can't move around. And that proprioception, or that ability for you to be able to orient yourself to the horizon like this. And so things that affect your inner ear, things that affect your nervous system, things that bother your stomach, a change in prescription, an overdose in herbs that are designed to really help speed up your metabolism for weight loss. I've seen all of those affect people and their ability to literally do this, which is be able to orient themselves. And it's devastating. Now, it can range from mild and random and erratic. It can be significant so that it's with you all the time. And so many times, the medical treatments and the alternative medicine treatments, sometimes they don't yield results. Vertigo is not always straightforward to treat, but some of the common sensations that you see with people that come in are this: a feeling of motion or spinning, a lightheadedness, an unsteadiness, balance, or gait, a feeling of wooziness. And then this is something that I really wanted to point out to people is this: if you have some of these new onset things like sudden severe headache, chest pain, difficulties breathing, fainting, double vision, ongoing vomiting, seizures, please don't wait and tough it out. Immediately seek medical intervention. Go to the urgent care, go to the emergency room. This is something that if it just started and you cannot orient yourself, do not delay. Get in and get to see someone. This presentation is more along the lines of what we can do for chronic problems. And so those are things like constant infection. So we're going to talk a little bit about that and blood tests for that. Inner ear problems, blood pressure and circulation, neurologic concerns, changing in prescriptions, anxiety. And believe it or not, we have such a huge problem with malnutrition. Now, malnutrition doesn't mean that you're full. Malnutrition means getting the right essential amino acids, essential fatty acids, getting complex carbohydrates, vitamins, and minerals in your system. And there's a ton of people that are overweight, that are malnourished. Now, this isn't an overweight problem, but I just give you an example. Just because you're full doesn't mean that you're nourished. And there's some really important minerals that I think have a significant place, particularly phosphorus. Molybdenum's another one. Selenium has a play in this, that if people don't have those in their diet, what happens is their nervous systems can't function very well. Now, another thing to review is some of the testing that goes along with vertigo. I like the top one the best. A complete blood cell count with auto differentiation can tell you if you're having a chronic infection. And if you've been seeing any of our live casts over the last 3 years, we know that chronic infection leads to neurobehavior. So your nerves behave differently, neurodegenerative, they break down, psychiatric, they can get in your head, cause anxiety, depression, fake autoimmune problems, and cause fatiguing illness. So you can find all this out if you do a simple blood test. Almost every doctor or urgent care hospital does a complete blood cell count with auto differentiation. I like to follow that with a complete metabolic panel. And one of the biggest causes of vertigo from a malnutrition standpoint is to make sure that you have enough iron, because anemia can really wreak havoc on your nervous system. Now, that being said, I want to give everybody a word of caution. Anemia is not something that you treat from a preventative standpoint. What I mean by that is so many times people think, well, I don't feel very good, I'm just going to make my blood healthier, I'm going to take iron. Please don't do that without a test. Iron is so important. If it's low, you're anemic, you're not going to feel very good. If it's high, you can have another condition called hematochromatosis, which means that basically the red blood cells of iron are overwhelming the organ systems of your body. Iron is just like sugar. Too high, you get diabetes. Too low, you get neuroglycopenia. Both of them can kill you. You want it to be balanced. Iron is the same way, but it is a significant culprit in vertigo. Now, common medical treatments for vertigo are common medical interventions: head position, Epley's procedure, using balance therapy, psychotherapy, physical therapy. Some of the common prescriptions for this are water pills, anxiety meds, migraine medications. It's important to have a prescription review. It's also important to have a nutritional supplement review, because if supplements are good for you, if you abuse them, they can be bad for you. Like if you get too much vitamin E, you can have bleeding disorders. If you get too much basically phytoin and nutrients, and if you're taking a something to thin the blood, it can counteract each other. But some of the weight loss supplements that I've seen, guarana is particular, licorice root is another. If people abuse those, it can give them a racing heart, and it can give them some vertigo. So you just want to be aware of that. Some of the advanced medical procedures for vertigo, you can do injections into the ear, you can do injections into the nerve, and in severe cases, there's a removal of the inner organ part. Now, that's not my world. I'm not a surgeon. So I just want to say, look, if I had vertigo, this is what I do. I'd back up a little bit and just do these things. Number one, I would try to get as much water as possible. Now, people say all the time, Dr. West, how much water should you have? This is what you should do. I think it's good to have triple digits every day. And actually, I would try for at least 100 ounces. A gallon is a good place to start. Now, a lot of times people are like, well, I only drink a glass a day, or I drink 2 glasses a day. Okay, just start to move now. Though the reason why I think that's so important is, again, if you don't have enough water, it's like Tin Man on the Wizard of Oz. And I've seen a lot of executives, they come in and they'll have vertigo and they're like, look, I can't look at my computer screen, or I can't do my administrative work. I've also seen a lot of guys out on the construction platforms, and they're pushing and what are they drinking? They're drinking coffee. They may be drinking some soda, energy drinks. It's not that they're purposely not getting enough water. They're not getting enough water. And for people saying, well, it's liquid. No, 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 no. If you have too many molecules in the liquid, which is what we call osmolarity, if you have too much osmolarity, you got to detox that. The only way to detox that is through water. And sometimes people say, well, I don't like the taste of water. Well, then you should try to get more water to see if it affects you, because I've seen really good outcomes with that one simple advice. It doesn't even cost anything. You don't need a medical intervention. It's really hard to overdose on water, but just try to get more. If you think you're getting enough, I encourage you to try and get 100 ounces every day. That's one thing. The next thing is nutritional balancing, looking at the blood tests and seeing, do we have enough calcium? Is the magnesium balanced? Do we have enough zinc? We're looking at these different factors, because if we have everything balanced, it's been my experience that balanced people don't get sick and balanced people don't get symptoms. And we're talking again about stress. How many people have stress? Everybody. Is it physical stress, psychological stress, financial stress, relationship stress, political stress, weather stress? Like, take your pick. And it can really, really affect your body. And you don't know which pathway it's affecting. Just have a good stress outlet. It can be reading, it can be walking, it can be gardening, although I don't understand that at all. And I'm teasing about that because I'm not a green thumb person. But whatever it is to help you to manage stress, you can need to get it on your schedule, 15 minutes in the morning, 15 minutes in the afternoon or the evening. And don't let anybody take away your power or your stress management. Review the prescriptions, review the supplements. Now, some advanced therapies for vertigo. Number one, immune system therapy. This is my favorite, where we skip the stomach and we go right into the vein. We do some vitamin C, B5, B6 is probably my favorite single thing for vertigo, because it has an anti-inflammatory component and it seems to calm down nerves. And then B5 is your feel-good vitamin. Now, you can get these across the counter, of course, but the best way to get them, or at least the fastest way to experience them, is an infusion treatment, cranial therapy, chiropractic therapy. My apologies to my physical therapist friends. I got in a hurry and I didn't write this in. Physical therapy can have some amazing effects on vertigo, getting everything lined up, doing Apley's procedure or Hall-Pike procedure, some of these other procedures for that, and then neural therapy. Now, I brought my neural therapy books right here because I reference these all the time. The Germans, like, and part of me is German, Scotch, Irish, Norwegian. I mean, my ancestors had a great time, but the German technique of these therapies, the Atlas of Neural Therapy and the Manual of Neural Therapy, these things teach you how to reset the nervous system. And how do you do that? You do that with a glycolized ether of a B vitamin, paraminobenzoic acid. You take a little tiny needle and you can go to these nerve control points around the ears. You can, on top of the mastoid, with an acupuncture point up here, a gallbladder component right in front of the ear. You can do them some auriculotherapy with these little tiny superficial injections. And what it does is the nerves come out of the nervous system and they go to the organs, tissues, and cells. They have to go to the skin. You can reset those by just working on the skin. They call this whole process neural therapy. And it's just a must if you have chronic vertigo. The other thing is oxidative insufflation therapy. This is a technique where you take basically a modified stethoscope and some oxygen and a little tiny bit of ozone, which is O3. You put it into the stethoscope tube. It gently pushes oxygen into the tympanic membrane, and we think that it has a really nice oxygenation effect to the central nervous system. Now, I've been observing this since 2005. It does kind of sound like you're in a wind tunnel, but there's some really nice effects for certain people. Now, the worst thing that happens is it's loud and you're like, I don't want to do that, or it doesn't help me. But sometimes people, especially with chronic ear infections and what they call those otoliths. So you have these little stones that float around and that they can roll on those, basically these little hair cells in the semicircular canals. And it's what causes disorientation. This is one of the ways that I've seen some outcomes. And I usually wait till the end to tell this, but one of the most important minerals that I see for the treatment of vertigo is phosphorus. Phosphorus has a really nice settling effect on the parasympathetic nervous system. Now, if you think of your body's a car, you have a brake here and you have the gas here, and they should be in concert with each other. So many times, especially people that are stressed or keyed up, it's the brake, or excuse me, the gas is on all the time and the brake never occurs. What phosphorus does is it helps to regulate basically the braking procedure of the nervous system. And I've seen some good outcomes with this. And again, there's no one size fits all with vertigo, just trying to give people some ideas of what they can do at home. So this is one of my favorite treatments for neural therapy. It's literally those strawberries, kiwis, I almost said Spanish. It's oranges, grapes, everything inside of a bag. We skip the stomach system, go right into the veins. And then the neural system, this complex interaction of these sodium potassium channels and the way that the nerve and the neurotransmitters connect through that synapse, you can affect that using this therapy. Now, it's really common in Europe. It's less common here, but it has a real nice resetting effect. Now, I always talk about the way we want to live is the best version of you. That's the stress management. That's taking care of yourself, going to bed at the same time, getting up at the same time, getting enough water, eating healthy and alive foods. Now, if you'd like some more information about that, how to work with this, like I said this a little bit earlier, and access some of the previous shows, you go to drjasonwest.live. I'm going to put it up right here. And this is what it looks like. This is a free resource for people. And I just wanted to give you an example of what people see when they do the free registration. We're going to have this vertigo right here underneath it. You can see previous lives, like, Lyme disease is one. What would I do if I had headaches was another. Patient success stories that are over there. And we have a free ebook download that you can get on vertigo. It's basically a summary of everything that I've said. It's right over there on Dr. Jason West Live. If you'd like some additional resources, that is where you get it. Now, just to review everything, what I would do for vertigo: phosphorus helps with energy and get calcium in the right place. Vitamin B supreme. This is if you have access to a good B vitamin, great. This is one of the things that helps the nervous system. You want to work with the adrenal glands. You want to help your immune system. And then I like something called vertigo drops. Now, if you have any questions, you can contact our patient care coordinator, Jody. That's inside of our program that you can see over at Dr. Jason Westloff Live. If you didn't have a chance to do this live, or if you need the book, that's where you go, and that's where you can get the resources. Now, inside of that, I forgot to mention, if you need a good place, a good things to help you with vertigo, if you'd like, I have some products that I've seen good outcomes with underneath the replay. It's sitting right there. Also, if you'd like additional information on different conditions, we're here every Wednesday night at 6 o'clock doing different subjects and different topics. This is the day before Thanksgiving. So next week, we're going to be talking about what you can do to help burn off some of the holiday stored energy. Like, I try not to use the F word in the office. That stands for FAT. If you got some stored energy over Thanksgiving, next week, we're going to turn about how we can burn stored energy or to burn fat. So basically, you guys, that is our program for tonight. We're getting ready to go over to the Thrivers program, which is an in-depth question answer period that I work with people every week. If you'd like some more information, you can pick it up right here inside of the website, and you can do some further work with us. It's the Thriver program that we can do. We do a virtual office visit with everybody every week, a podcast, a video secrets program, and there's a special interest-free financing through the end of the year. If you want to do some closer work with me, every Wednesday night, you get a virtual office visit. That's basically our show on vertigo. Get more water, get phosphorus, more B vitamins to help you. You have a stress management outlet. Consider some advanced therapies like the neural therapy. It's just so good for vertigo. I'm Dr. Jason West. That's our show for tonight. We'll see you guys next Wednesday at 6 o'clock. How to burn fat after Thanksgiving. We'll see you guys later.